we're missing Councilmember Dalhoff at the moment. So I think two of us are here, me and Councilmember Van Horst. So Kelly, do I get an approval for our meetings for September 10, 2024, please?
Yes, I'll move to approve.
Thank you. So we have a crisis response update by the fire department.
Councilmember Agave, can I ask that
Yes.
we have a second and a vote on those minutes
Oh yeah.
officially? Thank you.
Thank you. So going back to minutes of September 10, 2024, do I, Kelly, can you please make a motion for us to approve those, please?
Yes, I'll move to approve the minutes.
So move. So we will, the meetings of 10/9/10/2024 has been approved. Haven't done that. The next item on the agenda is the crisis response team update by the fire department.
Oh, okay. Thank you, Councilmember Agave. And I just want to take a minute and introduce our speaker for today. Crisis response has been a topic we've talked about for some time here in Tumwater, and how we might be able to approach that need in our community. Yeah, I've had the opportunity to meet with Joe and his staff. I believe Councilmember Dalhoff has well. I'm going to turn it over to Joe today. Joe Avalos is the Executive Director of the Thurston Mason Behavioral Health and Administrative Services Organization and Olympic Health and Recovery Services. And we're excited about a program he's going to speak about today regarding community-based crisis teams. So, Joe, I'm going to go ahead and turn it over to you.
Thank you and good morning, folks. Thank you for having me today. I'm going to see if I can share my screen. I've got a presentation here. All right, did that show up okay?
Yes.
Okay, great. And I've got multiple screens going, so feel free to stop me at any time. I'm going to start with kind of explaining who we are, because it can get confusing. So first, I'm going to go back. Chief, you mentioned, so my name is Joe Avalos. I'm the Executive Director for the Thurston Mason Behavioral Health Organization, and we actually have two entities under us. One is the BHASO, or TMBHASO, and one is Olympic Health and Recovery Services, or for short, we call it OHRS. So first, I'm just going to go back to 2020. We are quasi-governmental. We are governed by 2 Thurston County Commissioners and 1 Mason County Commissioner. We are essentially tasked as the BHASO to essentially provide funding for behavioral health care not related to Medicaid. So prior to 2020, we received all the Medicaid in the state for the Thurston Mason region. It was about $60 million a year. And then in 2020, the state decided to move all of that to managed care organizations like Molina and Amerigroup, United Healthcare, and they left the regional BHASOs with non-Medicaid funding. And where this will this make sense is that part of what we're tasked with doing is providing a crisis service system for the region, along with a bunch of other things listed here. We pay for involuntary treatment courts. We pay for hospitalizations for non-medicated individuals who are detained, and a bunch of other things. We have about 20 contracted providers for non-Medicaid services. This map just kind of shows the region. So we are Thurston Mason. I don't know why we were grouped that way, but it's been that way for longer, since before I was in this field, and that's been over 20 years. So it's just these are just a map of all the regions that we've got in the state. And then in 2017, a few years before integrated managed care, our county commissioners, our board chair, decided that we needed to do a little bit better job of outreaching the community, and they decided that we should do that ourselves. And so we created OHRS. So we are a licensed behavioral health agency. We primarily work in Thurston and Mason counties. And our whole mission is to provide service to our communities in Thurston and Mason counties outreach. All we do is community outreach. We do the LEAD programs. We've got hospital outreach. We have crisis outreach is our main book of business, but everything we do, we have about 150 employees throughout the different programs, and every one of them does a service out in the community. So that's our mission. But specifically for the crisis, let me go back here. Crisis services, which we're here to talk about today, this is the continuum that we do. We run a 24/7 regional crisis line that has been in existence for about 20 years or so. We receive about 3,000 calls per month. And that's going to be important as I talk about 988 a little bit later. So of those calls, we triage, the crisis line staff triage the calls. We respond with our traditional mobile crisis teams, which are folks that are just part of our main office and deploy from our main office in Lacey or in Shelton. Or we send a Thurston Mace designated crisis responder, and designated crisis responders are the mental health professionals in this state, the only ones that can involuntarily detain someone based on them being a danger to self or others. And so we do have those in Thurston and Mason counties. But then what's become our flagship model of care is our law enforcement co-response. And so these are our crisis clinicians that are embedded within local law enforcement jurisdictions. And we've been doing that since 2021, and it really has been a game changer for us and for the community. And so what the co-response model of care that we utilize is really not really a big secret. It's an evidence-based practice where we pair a crisis clinician, which is either a bachelor's level or master's level clinician with a certified peer counselor, and they go out as a team together. The clinician does the engagement from a risk level. They're trying to see if the person is a danger to themselves or others. If they are presenting as suicidal, how serious are they? Just thinking about it? Do they have a plan? Their role is really about the clinical engagement with the person in crisis and seeing what might be next for them. The certified peer counselors, on the other hand, really are more of a soft approach in that they are individuals with lived experience. They either have experienced behavioral health crisis or substance use and are in recovery from that, or they have had a family member go through something, and so they're able to provide support in ways that we really can't do typically as clinicians in the field. So it's a really great approach, and it's a best practice. It's really being supported throughout the state. It's being funded at that level, and we've been doing it at OHRS since 2018, and been very effective. The only thing that's been a negative is that sometimes we do need partnerships with law enforcement, where we do need law enforcement there for safety or because we're unsure of where we're going. So, our folks are all, they're citizens, they're attached to our agency, but when we go out, we really are responding. Sometimes we don't know where we're going. We don't have a lot of history of folks. So, at times prior to us doing this co-response embedded model of care, we would have to rely on law enforcement a little bit better just to kind of make sure that where we were going was kind of safe, especially when we didn't know what we were walking into. So I'm going to go to this one first here. We started our first mobile outreach team embedded with law enforcement with Lacey in August of 2021. And that was when Chief Almada reached out to us, really wanting a designated crisis responder. I think Lacey at that time was looking to replicate what Olympia was doing with their crew team, which is similar to what we do at OHRS, although I'll add that Olympia is, I think they use primarily peers and they are, at least at this time, not a licensed behavioral health agency. And that's important for a couple of reasons. The most important reason is that it allows us to draw down Medicaid services and other state funding that is restricted for behavioral health agencies. And so when Lacey reached out wanting a DCR, really what we talked about was, well, Lacey they had a crew team or co-response team that was a pair of officers that were responding, but they were really looking for more of an alternative response, without law enforcement. And so we talked about our mobile crisis team. We created the MOT team, and it was just, like I said, we have crisis clinicians, peer specialists. It's 4 FTEs. With the model of care that we've been doing for a while, they just are now dispatched and embedded within Lacey. It was so successful. Within the first 6 months of that program, all 4 of our staff received commendations from Chief Almada and Lacey team. And it's been going very strong ever since. It directly led to the Sheriff Scout team, which many of you have heard about, and it's really the same thing, same model. We've got 4 FTE embedded with the Thurston Sheriff's Department, and they respond, of course, to Thurston County, and they're all over the place. So going down to Rochester, Tenino, Yelm, I think they respond in Tumwater as well when needed. And then we went to the Mason Sheriff's Department. That started in August of 2023. Same model again, and all of these teams, so it's a total of 12 FTEs, 3 separate teams, have been really our most successful outreach since we started doing this work in 2018. We do have a couple of embedded designated crisis responders as well. We do work with OPD, and we have a DCR embedded with the crew team there. That's been a successful partnership that started as a WASPIC grant. As I mentioned before, they do have the crew team, so they really have their own city-funded crisis team. So the DCR serves to supplement that and provide intervention as needed for folks that might need involuntary assessment. We also have a DCR embedded with Shelton Police Department, and that, of course, they work with the with the Mason County co-response team. And then finally, in May 22. We added a DCR to the Lacey MOT team. So it's really, again, serves as supplemental to the crisis team in the event that there are involuntary assessments needed. So go back to this slide real quick, and just some of the impacts that we've seen reported to us really by all of the jurisdictions. It just provides a faster response for our teams to community crisis. And we have a lot more information, of course, when we're going out into the field. Definitely increases officers' efficiency. We do not have to rely on calling law enforcement officer to make sure that we're going into a safe setting. Most of the time, what works really well is if we get a call on, let's just say, John Smith, and this comes through 911, which does happen quite a bit. We can look in our electronic health records and see if we have any background information on John. Law enforcement jurisdictions can look in their system and also see if there's any history there. And that just provides for a better way to triage. And it allows our staff, especially if the information looks great, say we have a history, we know that John is not violent, and same thing for law enforcement, they can see. It allows our staff to respond without law enforcement while having as much information as we can on the person that we're going to see. This has led to a decrease in repeat calls for service. Our staff can input notes into the CAD system to let the officers know that we have a plan in place for the person and that we've done outreach, so they know if there's any further calls. Really, they just deploy the outreach team instead of having officers respond. And so what'll happen is when we do have our teams come in and to hear the hours of operation that we have right now, let's say a call comes in after hours and it's for John Smith, typically what will happen is that'll be a note for the outreach team to follow up with John in the morning if it's not, of course, an immediate danger. And so they do have a lot of follow-up outreach calls. just as a matter of practice now, because law enforcement knows that they are embedded there and they can refer to them. This is a dashboard of our 2023 services across the region. I think this is all of the corresponders combined. You can see the increase just over the last year, and some of that is because I think it was Mason came on a little bit later, so that's why you'll see the big jump from 3 to 4. But as more of the community and more of the officers that we work with and the jurisdictions that we work with are aware of what our teams are able to do, we just see more services. And again, been very, very good for us, very, very good for the jurisdictions where we are in. They're dispatched directly from law enforcement and 911. They bypass our triage system, although they are still in contact with us. And it just allows for a more effective, faster response. And in looking at the outcomes, most of the time we're able to stabilize the individuals in the field or with a follow-up call from us and referral to resources. Oftentimes we'll refer to outreach, so something like a LEAD program or a HARPS program, so that stands for Housing and Recovery through Peer Services, or we'll just refer to another community resource. We're probably the best stat that I think we have here is that most of our responses are without law enforcement, 85%. And that allows, and I'll just steal a line from Chief Almada, allows police officers and first responders to do their work, which is what we want. We want to, our whole mission is to right response at the right time. And if we're able to respond without law enforcement or without first responders, great. And let me see if and just looking here, these are the services that we refer to in the community. I won't go through all of the acronyms because frankly, I don't know all of them. I just wanted to list all of them so that you see, we utilize everything that we can. We use churches, we use CCS, Safe Place, Sidewalk, all of the myriad of social services that we have in our region. We have a connection to and can help the folks in our community get whatever they need to help them feel safe. So that's been also great as well. So I'll talk about what we've got coming up here in the future, but moving quickly to the funding for this. So this has been creative funding from our end. We utilize, because we're a behavioral health agency and we're allowed to provide the service, Medicaid pays between 40 and 45% of the cost of this service currently. And we do that all in the back end. Our crisis services folks will see John Smith, and we'll activate any encounter on the back end, and we're able to bill Medicaid services through the ASO because we're the billing entity for that. And that's great for our region because the way that Medicaid works in this state and maybe in the country is really widget based. The more encounters that we send to the state and to the feds on Medicaid, the higher our rate will be in the future as this is done. When the actuaries come and do utilization, that increases our rate for Medicaid and increases the overall funding that will come to our region for services. So it really is a win-win situation there. From the ASO side, we do utilize other federal and state funding to offset some of the costs for administrative pieces. All of our teams are provided with equipment, IT and software through our agency. Supervision is provided as well through our agencies, and of course licensing and all those pieces that come with part of being a behavioral health agency. And then finally, I've got a little bit of a typo here. The local funding that we get, and that varies. In Thurston County, it's their 0.1% of 1% sales tax. Lacey uses funding from their city budget, and the same thing for Olympia. And that approximately pays for about 45% of the costs. And they also provide training in kind. There's a lot of stuff that goes into it that each jurisdiction has to do. And that's things, how to use radio, how to use phonetic alphabet, and call signs and all the things that make a first responder law enforcement agency, that's unique to that we wouldn't know as just being, social service or crisis response clinicians. So that's what we've been doing for the last 3 years. What is coming up now as a result of the 988 reform and 988 tax is something of similar model to what we've been doing with law enforcement, but the state is wanting to call this now community-based crisis teams. And so this came out of House Bill 1134 last year as part of the state's investment in 988. And for those of you that aren't aware with 988, that is intended to be really the 911 of behavioral health. The state and the country would like to, this is actually federal mandate, they would like to have 988 really be the primary vehicle to which people in behavioral health crisis utilize, and the hope is to get away from 911 and have that be more for emergencies that require law enforcement and fire, and have 988 really be the vehicle for mobile crisis response. In this state, 988, we're moving a little bit faster in that the state would like 988 to replace the regional crisis lines, and I mentioned earlier we run one of those crisis lines by, I believe, January of 2026. That's the date they're looking for. But to do that, they also have to have a response system similar to what we have now with 911 and first responders. So a lot of investment has gone into increasing mobile crisis teams, and specifically increasing and creating community-based crisis teams. And so community-based crisis teams are very similar to what we've been doing with law enforcement jurisdictions last 3 years, except that they are now specific to embedded teams within fire service agencies or EMS agencies. And then there's a couple of other entities as well, other than law enforcement. And so I think this kind of presents an opportunity for Tumwater. I know I met with Chief Hurley. We met with with Mayor Pro Tem Dahlhoff and some other folks as well about this. And it's something that we've not done, but we have the model already established and shown that it's there to work, and it's worked well. So we already have kind of the template for how this might work. Again, this is straight from the RCWs that are now in place. To meet the conditions of a community-based crisis team, a fire service agency must be partnered with a behavioral health agency, that'd be OHRS, that also has a contract with the BHASO. So we're unique in that we're both of those. This is where the funding will actually flow through our ASO side of the house directly to our BHA, and then hopefully also to the fire service agency. And that's where I'll get to the funding for this. So there were a couple of provisos that came out of the last session, and I think the session before, in order to establish not just CBC teams, but more mobile crisis teams as well. Establishment grants and $144 million for the actual service delivery. I left that part out there, but this is what's coming and how the model is expected to flow. 988 tax to the healthcare authority to the ASO, and then finally the ASO to the provider / first responder. What we've been told is that not only will some of this funding pay for the staff, the clinical staff that we have through OHRS embedded within Tumwater Fire as an example, but it may also pay for part of the first responder staff, which would be a first for us. We have several contracts with entities throughout the region, but we've never paid for first responder staff before. So that would be a first, and I'm still curious myself as an administrative side, how are we going to do that? Because that's not really our book of business, but that's the way the state would like to have this flow through. So we're absolutely willing to partner, and looking forward to seeing what that funding looks like, because that's kind of the unknown still. We do know that this is coming. We do know that the timeline right now is that any interested community-based crisis teams have to submit an application to the HCA by January of 25. And then there'll be an on-site review by the healthcare authority program staff February or March of that year. And then finally, July is when they expect services to begin. So I've been part of this buildup from the ASO side with the state for the last few months. We've had a lot of questions for the healthcare authority. I think they themselves have had a lot of questions. But in just hearing the way that the other regions are set up, it's pretty clear to me, quite frankly, that we are in the best position to actually launch and successfully apply and to be a CVCT, largely because we've got this history already with doing this very similar work with law enforcement, and having the opportunity to potentially do this with Tumwater would be our first fire-based agency. I think the partnership that when I met with Chief Furley and Tumwater Police Department, I think that's unique as well, compared to the other region or the other jurisdictions where we work. So I think that would present an opportunity. And then, one for the providing the service that's needed for sure, but then also this might actually become a budget neutral thing for you all as well as you consider, which would be fantastic for all of us. We want this to work for sure. And if the state is investing and they want to pay for it, we're happy to make that work for them too. I think that's all I have. I went through those pretty quickly. I wanted to make sure I had time for questions. So please, happy to take any questions at this time. Let me go back to the timeline here, just so I've got that up there.
I guess I'll ask you a question, Joe. Obviously, this is a pretty new program. Historically, these programs have been embedded with law enforcement. So, clearly a shift in some degree to the fire department. And I guess I'm just curious on your thoughts there, advantages possibly of doing that.
So our programs have been embedded with law enforcement, but across the state, there are many, many co-responder teams that are embedded with fire. But it's a different model. Typically, it is one social worker or a mental health professional deploying with fire, with either an EMT or some other fire service staff. And it's usually a two-person kind of deal, but it still involves first responder staff. I think this model and the approach that we've done, I think we'd be able to kind of replicate it in the same way, where much of the time we really wouldn't need fire to respond. We would need to absolutely rely though on the partnership that you have with Tumwater Police, because there would occasionally still be instances where we would need police response, or at your discretion of your fire folks, what we would need safety, and sometimes that does happen. So that would be the unique thing about this, is that we would absolutely still require at times law enforcement response, or your discretion with that and in helping to triage that.
I think Leila have a question. Councilmember Leila does have a question.
Thank you, Chair Agabe. Hi, Joe. Nice to see you. You actually answered the question. I was thinking, because Tumwater Police and Fire work so closely, that I think this would be a great example of showcasing how they work and respond to our community. So I think it's a great example. And I missed the first part. Apologies. I had met with you in April, right? And the recent example of these conversations for me were the Regional Fire Authority, when that was presented to the community, and the talking about evolving and adapting services to our community members. So I think this is just timely. And just to be clear, my bias is in support of this, and however it can work to address the needs. We've heard concerns from our fire, concerns from our police about the type of calls. And I feel like this is a win-win to try to show that we are responsive to the needs of our community. And another thought I had is projecting into the future, knowing that Thurston County Sheriff, their office is moving one block down from City Hall. Is there an option to have a conversation down the road, if they do open in 2026, that some of our police move there? And then would that lead to a stronger relationship if we are in the same building as you?
Oh, absolutely. I think, so I haven't had the conversations yet with the sheriff about how the scout team evolves. I still honestly would really like to push back on the state. I don't know why this funding model excludes, doesn't just exclude it, calls out that law enforcement can't be a part of this. I think, I think that was, I'm just gonna, I think I know which legislator kind of input that there. I'm not gonna name names, but I'm gonna see them at I think there's National Crisis Conference coming up, and hopefully going to chat with them about why that's an issue. And I believe it is because they want to get away from the model of having law enforcement respond to every crisis call, because most of the other law enforcement co-responder teams are not like ours, where we have the team embedded and are being dispatched. It is similar to what the co-responder models are with other jurisdictions in fire. It's a social worker or mental health professional paired with law enforcement, and they deploy every time. So it's a very different model. And I think that's what some of the legislators would like to get away from. They want to be these teams embedded with fire, with other EMS deploying and removing the need for law enforcement altogether. So hopefully, by showing our model where, yes, we're embedded with law enforcement or with fire, we're still responding as a crisis team and being deployed, and only really relying on those necessary first responder services when they're absolutely needed.
Right, thanks.
I do have several questions, so I'm going to try to break them down to biteable sizes. So currently you are embedded with law enforcement agencies. So do you assist in involuntary commitment or forensic psych?
On the forensic, okay.
Go ahead, answer that for then I'll follow up.
So it really be on the civil commitment side for involuntary commitment. That's what our DCRs do. And so, yes, we do that. Typically, we'll respond in the community with our mobile teams. We don't like to send DCRs unless they're absolutely necessary, and primarily because DCRs are always very, very busy. They have they're typically in the hospital all the time. It's very hard to keep DCRs fully staffed because they've got kind of a tough job. So really like to utilize them at only when absolutely needed, and primarily in the community, because when we send a DCR in the community, we absolutely need law enforcement, and which is what we're trying to avoid, right? Because the DCR, first thing they do is they have to read rights. So it has a very different engagement model than our mobile teams, who can go in and have, that's really about engaging. It's really about having a soft approach. How can we help? What's going on? Whereas with the DCR, that's a legal investigation. They have to start with, I'm a desert crisis responder, I need to read your rights. And that can escalate things just by the mere fact of somebody doing that. It sounds like they're getting arrested, and that, it's just, it doesn't really work that well, quite frankly, in the community. What we'd rather do is have our mobile crisis response. If they're concerned about somebody, oh, my lights here went off here. Let me. If they're concerned about somebody in the community, then typically they can have somebody. They need to go to the ER to await a DCR. Then that could be the next step. But we're really trying to avoid that. In the community if we can.
Good. So by way of disclosure, I work with the Certificate of Need program with the Department of Health, and the Behavioral Health Hospital in Lacey was part of my project. And I know that facility probably has, 65 beds right now, maybe a little bit more. So you talked about all the community resources, but what you didn't talk about, or you gave a list of the community resources, but what you didn't list or talk about is about how many beds do we currently have in Thurston County? And is there in the future beds that are going to be online that you know of?
Yes. So are you talking about the South Sound Behavioral Hospital that you were part of
Correct, correct.
Yeah, so South Sound Behavioral Hospital, they're literally across the street from our main office in Lacey. We work with them very, very closely with them. They have about 134 beds, I believe, and they are a mix of voluntary, and they do have involuntary beds as well. And then we have three facilities operated by Telecare. One of them is in Olympia, close to St. Peter Hospital. They have 15 involuntary beds and 11 long-term civil commit beds. So those are for folks that are still on involuntary holds, but are longer, so on 90 or 180-day holds. And then finally, we have actually the facility in Tumwater, right next to the jail there, that is also run by Telecare, and they've got 10 beds of short-term involuntary and 6 beds of long-term civil commit. We also have an empty facility off of South Bay Road that we hope will be operated soon by one of our partners. That was intended to be run by Recovery Innovations, but they pulled out at the last minute. It's literally turnkey, and I hear that they're in negotiation now with one of our local providers on. Hopefully that'll open up soon. And then finally, we are a phase 3 True Blood implementation site. And so this is the lawsuit that the state settled as they were taking too long to get folks that were not found competent to stand trial to get the evaluations and treatment. And so they've invested a ton of money into providing inpatient and outpatient services for this population. So one of the things that's coming through, I think in the next couple of months, will be an RFP for a crisis stabilization facility. And this would be a voluntary unit up to 16 beds, I believe, for police drop-off that is supposed to be a lower level of care than our involuntary facilities that could turn folks around that need 23 hours to 3 days of just crisis stabilization in a facility. And then be transferred to whatever's next. So that's coming in the next couple of months, the RFP in any case, and that comes with, I think, $5 million this biennium, and then additional funding in the next cycle for operations. So we got a lot of beds. Actually, we have, quite frankly, sir, we have probably too many involuntary beds in this state to what's needed. And the only reason I know that and say that is because we have to pay the court costs for those. And about half of the court costs for those are from over half are for individuals who are from outside of the Thurston Mason region. Probably too much information, but that's a whole other presentation I'd be happy to do too.
Thank you. I think Councilmember Van Holt have a question.
Not so much a question. So nice to meet you, Joe. I worked for DSHS as the media relations manager for behavioral health. And so it's so cool to see all the work that was going on to bring more beds to the community and more crisis response, so people aren't inadvertently languishing in jail when they really need mental health support. So I just want to thank you for your hard work, and I'm sorry that there's too many involuntary beds, but we're on the path to the right way to treat people who have mental illness, and I'm really appreciative of your work.
Thank you, I appreciate that, and I part of that was said in jest. It's mainly because the court costs that we have to do for the whole state. Yes, everybody's getting the services they need. South Sound's a great partner. Telecare's have been a great partner. There's still a lot of gaps though, for sure. Even for us, we're providing more crisis services now in the community than some of the regions that are much bigger than us. They're definitely more than the regions that are the same size as us. And so that speaks to the need for sure. It speaks to the gap in the community that has been in existence for forever. So I'm glad that we are kind of moving in the right direction, but definitely still more services needed for sure.
And real quick, I know that I think in 2021, the number was 1 in 5 Washingtonians had been or were able to be diagnosed with some form of mental illness. And I've been curious if that number has changed since COVID, or if that remains true?
That's a good question. I'm not 100% sure, but I will. I'll research that and get that back to you for sure. I can tell you, not related to diagnosis, but I'll speak to we've increased our crisis service mobile outreach probably 4 times as many services now than we were doing just 3 years ago. But one thing that hasn't changed is our involuntary evaluations. So, naturally, before 2018, the only crisis response that we had in this region was our designated crisis responders. And so, as a result, if you're just responding with people doing involuntary evaluations, your numbers are going to be really high, of course, because you're just doing an investigation for involuntary every time. When we started investing in a mobile crisis service and having our teams go out instead of DCRs, I naturally expected, well, we're going to see less involuntary evaluations now because we're sending more of our mobile crisis folks and we're kind of preventing some of that, at least I thought. We haven't seen that. The involuntary evaluations have stayed the same or increased over the years. Some of that might be because we now have more people come into South Sound, for example, that from out of the region to get voluntary services, and sometimes they need to be evaluated for involuntary, so that prevents some increase. But I think it shows that we just have a lot of need, and I don't know what the end. I don't know where the end is. Each year, as we start doing more crisis service in the region, I'm thinking, okay, I think we've hit our saturation point, but the numbers just keep going up. So hopefully we'll get there soon. But just to kind of put it, as what I'm seeing in terms of service, there's certainly a lot of need out there for sure.
Thank you very much. And I think we do have an action item. Is that what I'm saying? Lisa?
They're not specific to the crisis response update at this point. We're working with Joe and his team to explore the application process that he mentioned that is beginning between now and the end of this year. We do intend to move forward, and the budget contemplates us moving forward with that partnership with Joe, and we're actually really excited about the opportunity to have that collaboration with our fire and police departments, as well as with Joe and his team. So I would imagine the first thing that the council will see in terms of an action taken is if the city of Tumwater needs to be a part of this grant application, we'll need your approval for that. And then we'll definitely be back in front of you with some sort of a service agreement with Joe and his team before we get started. But we're really excited about the opportunity to potentially have a really proactive crisis response in the city of Tumwater on July 1, 2025.
Thank you very much. And thank you, Joe, for the presentation.
Thank you for the opportunity. I appreciate it. Look forward to connecting and getting to work on the application.
Thank you. So moving on to item number 5.
Yeah. Well,
Okay, go right ahead. So
yeah. Well, good morning, Councilmember Agabe, members of the Public
morning.
Health and Safety Committee. I'm here to deliver a resolution that staff was invited to bring to the Public Health and Safety Committee today. The topic is Resolution R 2024-015, affirming the Council's commitment to equality, dignity, and the protection of civil rights, and standing against hate, bigotry, and discrimination. The reason why: we have recent events at the national, state, and local levels that have highlighted the need for the community to take a stand against hate and the violation of civil rights, and reaffirm a shared commitment to justice, equality, and human dignity. So this action or resolution not only provides a values-based foundation for our work, it also supports our strategic priorities to build a community recognized for quality, compassion, and humanity. Staff's recommended action is to adopt Resolution R 2024-015, affirming your commitment to equality, dignity, and the protection of civil rights and standing against hate, bigotry, and discrimination as a step towards bringing it to the full council for consideration. So that concludes my introduction of the topic for discussion here.
So by way of background, this resolution happened as a result of incident that happened to Council Member Dalhoff. And because we don't yet have a commission, so this resolution, if adopted, would stand alone. And what I do not understand, what I don't know or haven't yet anticipated is what this will have, what kind of relationship this will have with the commission when that is adopted. So that's just a statement from me.
Would you like some somewhat of an answer?
Well, sure.
Okay, so I really feel like this is a really important first step towards creating a platform in the city of Tumwater that can help us as a community have conversations, difficult conversations around racism and hate and bigotry, which we have heard of instances of those things happening in our community very recently, including the incident with Councilmember Dalhoff. And so I feel like this is a first step. The purpose around the purpose around the process with the Equity Commission is to do some outreach with our community first and understand what people's lived experiences and issues are, and to then follow this resolution with a resolution that is specific to establishing an Equity Commission and identifying its goals and priorities, which will be established by virtue of this outreach process. So this is an important first step. The relationship between this and the Equity Commission is that this basically sets the stage and identifies the need to have this community platform. And then the follow-on resolution that we would anticipate shortly after the beginning of 2025 would set about to establish the details of the Equity Commission itself and get that program launched and rolling.
Thank you. Councilmember Dalhoff?
Thank you, Chair Agabi. I'm wondering if we can get an update from Commander Mason regarding the incident that happened in May, which is the impetus for this resolution.
What kind of an update would you like?
Were you able to communicate with the parties involved, and what has evolved since you reached out to the participants?
Okay. So last public health and safety meeting, I said that I would reach out to some of the involved parties, and I have reached out to all of them, and I received some information back. Some did not respond back to me, and which is their right to do, right? So I guess, what is it that you were looking for?
Well, in the resolution, it talks about what we're going to do in building relationships. So you started that, right, by reaching out to 3 people that were specified, right? And so, I mean, this
100%.
is a perfect example, right? This is a perfect example of this resolution. If someone doesn't reply back, what do we do? Like, right? So that's why I wanted to see an update from you. Like, were you able, how do we build that trust and rapport to get people noted in that resolution? We want them to feel comfortable and trust us to give us their stories and give us their examples, right? So if they don't feel comfortable and they're not replying, how do we keep going? I guess that's what I'm looking for you.
So what I would like to do is talk generally, not specifically to this incident, because I don't want to highlight anyone.
Got it. Perfect.
So what we do, the service we provide is strongly built on relationships, and we're always trying to improve them. Obviously, if we reach out proactively to individuals, we would love to have them respond and have a conversation so we can understand how we can improve services and we improve communications. We also have to respect individuals who don't feel comfortable talking with law enforcement. Maybe even, me personally, I'll just use me as an example. Maybe they don't, I don't have a relationship with them. And so as opposed to continually pursuing them, talk to me, talk to me, talk to me, I have to respect, we have reached out. I know, in other situations, others have reached out to individuals and asked them if they feel comfortable talking to law enforcement or if they wanted to, and they may choose not to, and that's okay. But it's a constant process of trying to build trust, trying to build relationship, and trying to provide service to all at a high level. So does that answer you? I mean, it doesn't
Yeah.
stop. And but I also so I have come individually, professionally a long way since 2021 and some of those events. Prior to that, I really felt comfortable presenting myself as a police officer and showing up to nonprofits, showing up to community events, and being visible. After that, I really kind of evaluated and trying to understand and recognize that there may be some events that they don't want a uniformed law enforcement officer there, right? And I want to respect that. I've had really great conversations with several groups in our community. And one of them, it was really powerful for me. And so they were having a community event. They called me up because we have a relationship, and they said, hey, we want you to be aware of this community event because we think that there could be some people that may come in and try to disrupt it. And we don't want any visible law enforcement at our event. And I have to respect that, right? And so we have these communications and we provide services and we provide these opportunities as we can, but also kind of, balance in community and the wishes and needs of community. So
I appreciate that, Commander Mason. So with that update, when I first read the resolution, I replaced Tumwater and just added any other city. And so I feel like it's a good starting point, but I would like it to be specific to Tumwater because Tumwater is different, right? And so I would like to continue this, if there's options for some zhuzhing in the resolution regarding the current state and the future state, right? So to hold us accountable and that we don't give up on our community, right? So I would like it to be more action oriented and specific to Tumwater because it feels too generic for me. And I want us to show that we aren't just words, like Commander Mason, that follow-up, that respect and building that trust. I feel like that should be highlighted more in our resolution because that's who we are in Tumwater. We don't give up on each other. So that's my comment. I appreciate it. I think it's a great start and I would like it more Tumwater specific.
But then I guess the question then would be, are you proposing an amendment to the resolution then?
I mean, not an amendment, but I would like room for some edits to talk about, to be more specific moving forward. So I'm not ready to have it go to council for a vote. That's what I'm saying.
We would be more than happy to add specificity if you could provide us with some guidance. The resolution itself was brought to staff as a starting point from Councilmember Agave and based on his research. And more than happy to look at ways in which it can be more specific to the city of Tumwater. We would just need to understand what that looks like.
Yeah, thank you, Lisa. I appreciate that. I just think this is we're having these uncomfortable and difficult conversations right now, right? So we're modeling the way, and I just feel like we need to specify the future state a little bit more. We don't have to be like call out, but just, I don't know. I just feel like in Tumwater, I don't want it to be just another resolution that is just words, but really be specific of this is serious to us and that's why we're doing it. And we're not going to stop until everyone feels welcome. That is going to be an ongoing process. And there's certain behaviors we just won't tolerate and what that looks like.
I appreciate that. And maybe what I could suggest is at some point in the time in the very near future that perhaps Jason could reach out to you to talk a little bit through some of your specific requests.
I would love that. Thank you. Appreciate that.
Sure.
Okay, so having said that, my understanding
Fair.
of what you're saying.
Can I just interrupt for just a second?
Sure, go ahead.
I would be remiss if I didn't note the irony that, and I'm appalled by what happened to Councilmember Dahlhoff, but that was what pushed us as a community to do with this resolution. Councilmember Agabi, I know that you have encountered moments of racism in your own personal life. I, as a woman of color and my family living in Tumwater for the last 15 years, have encountered racism in our schools, in our community. And so I am appreciative that this work is happening, and I want to second Councilmember Dahlhoff's plea that this not just be words on paper. It's time for the city of Tumwater to really stand up against hate that is very prominent in our community, unfortunately, and that we are going to walk our talk. And so since we're having uncomfortable conversations, I would be remiss if I didn't point all of this out and second Councilmember Dahlhoff's plea.
Thank you. Thank you. Councilmember Dahlhoff, Mike, I do have a question. So if we were to edit this and make it a specific to certain actions, what actions might those be? Because at the end of the day, there's still going to be just words on a paper that are not tied to any specific policies or procedures that are currently obtained in Tumwater.
Right. Thank you, Chair Agabi. So some examples off the top of my head is we have been requesting a joint meeting with the school board. That has not happened. So that should be like the partnership and collaborations and specify our partners. Another thing is about, Lisa talked about those, the equity commission, but those conversations. So being intentional about who we're talking to, right? I go back to the police, the focus group conversation. So if we're going to do focus groups, how are we intentional about the stories we're going to hear that we haven't had those touch points? So the focus groups, the partnership with the school district, the partnership with the buildings, right? So being more intentional and action oriented instead of just saying we're going to build trust and respect, we want you to be able to come to us. How are we planning to do that, right? Is there a way, if you have a touch point with a police officer or something, that there's an anonymous survey you can do, right? You could text back your interaction. Or if something has happened but you don't feel comfortable, is there an anonymous way to do something on our website? Those type of things is what I'm looking for, is how we're going to build that trust, right? Because Commander Mason gave those examples of people don't feel comfortable, right? So how do we work with that? So those are some top of the head examples.
Okay. All right. I think I see where you're coming from. If we are going to have a resolution and then mention some certain entities or persons in that resolution that binds us. That resolution is no longer a resolution. It's more of a proclamation that points to a specific policy within the city that we are hoping to redress. So that is just my concern. So let us move on, and then let's see where this leads to.
Valid, Peter, thank you.
So I think the next item we have is the additional item, I think. Does anybody have any additional item to add to our meeting this morning? That is not already in the agenda. Okay. On that note, I don't have any additional item. So if I don't hear any, that means that we are adjourned then.
Have a great
You
day.
guys have a good day. Bye-bye.